Well, medicine is a historically male-dominated profession, and while the gap may be closing more and more each year, it isn't close to well, being equal just yet. This is especially true in specific fields like internal medicine and anesthesiology. So joining me now to tell us more about these discrepancies is Dr. Michelle Nentwig. Thank you so much for being here. And I want to highlight your title because this, I feel like, this directly ties into everything that we're going to be talking about. You're an orthopedic trauma surgeon from HCA HealthONE Mountain Ridge. Okay, so speaking of which, orthopedic surgery, one of the most male-dominated fields in medicine. What are some of the things that you have had to face as a woman?
I think overall it's a very demanding job, physically, mentally, time-wise, like the commitment to your training definitely requires a lot of dedication and work and time.
And have you felt that certain people, whether they're aware of it or not, may discredit you just because you're a woman? Have you ever sensed anything like that? Or do you feel like that there's a challenge to overcome that?
I think that earlier on in my training, I probably felt that a little bit more. But, it takes a little bit more maybe to build people's trust as a woman. But overall, I feel like I've been very fortunate to have great mentors and people that, are very supportive.
And what about women coming up in the field? Do you see more women getting into some of these fields in medicine that are predominantly male-dominated?
Definitely.
Oh, good.
Yes. I feel like every year I go to our conferences, I see more and more women going into trauma, into joints, into, all the different specialties, which is really great.
And you're one of those pioneers and mentors now. Like, that must feel pretty good. Do you
Yeah.
ever think about your path and shattering those glass ceilings?
I don't think about it a lot, but when I do, it definitely feels very good. And it's really nice to be able to mentor med students and younger people as they're coming up.
Well, you should.
Yes,
I have a 9-year-old daughter, and I think of, if she were watching this segment and seeing someone like you, that matters. Representation matters. She can look at you and be like, wow, here is this very beautiful, kind, smart woman that's also very successful in her field. Both can be true, and they're not mutually exclusive. And I think that is a very important message. I just want to know, has there been any surprises being in your field as a woman?
I think just overall the feeling of community that you get within, I thought maybe it was going to be a little bit more isolating as I was starting. But overall, I feel like the support more and more and the mentorship has been really exceptional.
I love that. That's great. Any advice that you would give to anyone watching, I'm going to say females specifically, that want to become orthopedic surgeons?
Just do it. Just commit to it and, make sure it's something you really want because it is a long road. It's lots of time and it does require a lot of commitment. But if that's what you want to do, just go for it because it's the best job ever. I love it.
Oh my gosh. Just do it. You heard it from one of the best. Dr. Michelle, thank you so much for being here.
You're welcome.
For all that you do. We appreciate
Thank you so much for having me.